My name is Kevin Clark, and this is the story of Memory Lane. Memory Lane is on level 1 of the Prince Charles Hospital, and it connects basically all of our internal medicine wards and also our geriatric units and specialist units within the hospital. So well located in the hospital for a lot of people's use. People that are admitted in our inpatient medical units and geriatric evaluation management units, they're in hospital because they require inpatient care for acute medical conditions. Sometimes it's very easy to lose social connectedness, very easy not to be walking as much, engaging with people as much. So the concept of Memory Lane was born out of this. So Memory Lane is about 100 metres in length between our inpatient units. And I guess as you take, a walk or a trip down Memory Lane, you're seeing a series of photos, I guess, that have been brought together and designed with our community members, our staff, and they're sequenced in a way, I guess, that takes a journey through Brisbane, I guess, in southeast Queensland, of places that people will remember, whether it's travelling on a DC-9 plane, whether it's, being born at the maternity hospital at the Royal Brisbane, there's a photo there. School milk is often one that triggers a lot of conversations. We worked with the Royal Historical Society of Queensland and the Queensland Library to find these photos that really capture, I guess, the last probably 70 to 80 years of Brisbane and southeast Queensland history. The foundation has been really instrumental in helping us right from the initiation of the idea, when approval was given by our hospital executive that we could do this work, to basically helping us do the planning, connecting us with the right companies. Financial support was really valued and appreciated right through the implementation, and equally the foundation's helping us to evaluate the effectiveness and the impact that it's having in our community. We know when people are in hospital, it's very easy to not do as much as you normally would at home. So when you're at home, you're getting up to make a cup of tea or answer the phone or connecting with people socially, your next door neighbour or your community. So what Memory Lane is so good at is, I guess, it's an area outside of your bed space or your ward where you can go with our staff, with family and friends, and it's an opportunity to look at photos and have a discussion. Really the benefits is partly around helping keep sort of muscle strength and getting people up and about. Just walking, standing is really good versus sitting in a chair beside the bed or in bed. Equally, just that cognition and social engagement is a really big benefit. The knowledge we have around reminiscence, nostalgia, and the benefits of that, I guess, if we can tie that into someone's inpatient care, was something that sort of drove and initiated this idea with our geriatricians, our general physicians, our nursing, allied health teams really help us drive that. And the work with our foundation was instrumental in helping us achieve this. It took us 12 to 18 months of planning to achieve this, but it allowed us to co-design this work with patients, family and our staff and our community, and really have good engagement with everyone. We've had really great feedback. One of the photos is around the Commonwealth Games in Brisbane in 1982. And I can still recall a story of a patient with her daughter talking about the little wallabies and joeys that were there, and talking about a family member that was part of that opening ceremony for the Commonwealth Games. And the daughter didn't know this. So it just created, I guess, a connection with the mum, the daughter in hospital, as well as providing the benefits, I guess, of getting up, walking, and having a place outside the ward that's not as noisy, not as busy, just to, connect and have an opportunity for a discussion. The foundation's been instrumental, I guess, in really facilitating us to not only plan the Memory Lane, but also implement the Memory Lane. It's been great to work with the foundation on this.